Now in the autumn of 2023, we are expecting a new wave of respiratory infections like every autumn. And probably we will see quite a high number of COVID infections again, infections by the SARS-CoV-2 virus, even though we have a pretty good immunity situation in the community. The good news is that severe infections have become very rare, and it's very unlikely that we will see another wave of a lot of severe infections. As probably everybody now knows, these viruses have a tendency to adapt and to change, to have mutations. This is a natural phenomenon that occurs with more or less all viruses, and it is very pronounced in the SARS-CoV-2 virus. The virus has the ability to change, and that way can escape to some extent the immune response. And it makes sense that this develops. So if somebody is infected with the virus and has partial immunity, only the subtypes of the virus that escape that immunity will be able to replicate and can then again infect somebody else. And these changed viruses always have an evolutionary advantage over the old school viruses. And that's why we see new and new mutations coming up. We now have a group of mutated viruses that are only partially covered by the older vaccines. And that's why new vaccines now have been developed that include the antigens of these new strains. So the old immunity from the old vaccination or older infections provides partial protection, which is usually enough to avoid a severe infection. But with the adapted viruses, this protection will be improved. We learned that SARS-CoV-2, even though it can cause severe infections, thank goodness, was not a big threat to our liver disease patients. Only patients with very advanced liver disease, decompensated liver cirrhosis, really were at high risk of a severe infection. If we now look back at the past 12 months, we haven't really seen severe SARS-CoV-2 infections anymore, even in the elderly, with very, very few exceptions. So the danger of this virus to rare liver disease patients and their families is much, much lower than it was in the situation 2 years ago. Nonetheless, it's an infection against which there is protection by immunization, and therefore you should consider whether you should have a booster vaccination, and that consideration includes: have you had the infection in the past? How severe was that infection in the past? How high is your risk? How old are you? Which immunosuppression you're taking? How advanced is your liver disease? And it should be an individual decision that you discuss with your doctor. Generally, we would say patients on higher doses of immunosuppression, advanced liver disease, older than 60 or 65, should have a booster vaccination with the new booster vaccines. We should be aware that there are a number of different viruses that cause respiratory infections. And some of them are at least as dangerous as SARS-CoV-2 now. With SARS-CoV-2, as explained before, it is very unlikely that you see severe infections. We will only see a few. Influenza in particular, also the RSV virus, the respiratory syncytial virus, and some other viruses can cause severe respiratory infections in some patients, especially with chronic diseases and in the elderly. Influenza in particular is a potentially dangerous virus that can cause severe disease even in the young. And we would strongly recommend patients with a chronic liver disease and patients on immunosuppression, as well as elderly patients, to have an influenza vaccination this autumn. And many organizations even recommend that for anybody who has a lot of exposure, like school children, teachers, people working in the healthcare system, that they should have an influenza vaccination. You can't protect from all these viruses. There's a new vaccine also against RSV, this respiratory syncytial virus. And you should discuss with your doctor, if you are a patient at risk, whether this vaccination should apply to you. And then, of course, the question is, to what extent can I protect myself with a face mask? This can be useful if you are in a high-risk situation, like travel in a cramped bus or in a cramped aeroplane, to use a face mask there to reduce the risk. It will always just be risk reduction, but in high-risk situation, this has always been a measure that can be helpful and certainly can be helpful in this coming winter season for at-risk patients in at-risk situations.